Welcome to Clinical Tools Library, evidence-based scales and questionnaires designed to support healthcare professionals in practice. The Patient Health Questionnaire 9 assesses the presence and severity of depressive symptoms in adult patients. It is a self-administered screening tool that evaluates 9 diagnostic criteria related to major depressive disorder according to established psychiatric guidelines. The instrument measures symptoms such as anhedonia, depressed mood, sleep disturbances, fatigue, concentration difficulties, appetite changes, psychomotor agitation or retardation, feelings of worthlessness or guilt, and suicidal ideation. Its main purpose is to facilitate the identification of depression and monitor treatment response over time in clinical settings. The questionnaire aids healthcare professionals in making informed decisions regarding diagnosis, treatment planning, and patient management. The Patient Health Questionnaire 9 is indicated for adult patients in primary care and mental health settings who require screening for depressive disorders. It is most useful for patients presenting with symptoms suggestive of depression or those with chronic illnesses that commonly co-occur with depression, such as diabetes or cardiovascular disease. The tool facilitates monitoring symptom severity and treatment response across diverse populations, including general medical patients and those in psychiatric care. Its use is validated in outpatient clinics, hospitals, and community health settings, supporting standardized assessment and guiding clinical decision-making. The Patient Health Questionnaire 9 consists of 9 items designed to assess the frequency of depressive symptoms over the past 2 weeks. Each item asks about specific symptoms, such as loss of interest, feelings of hopelessness, sleep disturbances, and concentration difficulties. Responses are recorded using a 4-point scale: 0 for not at all, 1 for several days, 2 for more than half the days, and 3 for nearly every day. The total score ranges from 0 to 27, with higher scores indicating greater severity of depressive symptoms. Scores from 0 to 4 suggest minimal depression. 5 to 9 indicate mild depression, 10 to 14 correspond to moderate depression, 15 to 19 reflect moderately severe depression, and 20 to 27 signify severe depression. Clinicians should consider these thresholds alongside clinical judgment to determine the need for further assessment or intervention. The Patient Health Questionnaire 9 demonstrates a sensitivity that typically ranges from 80 to 90% in detecting major depressive disorder. Sensitivity refers to the ability of the tool to correctly identify patients who have the condition, meaning that 80 to 90 out of 100 individuals with depression will be accurately recognized by this questionnaire. Specificity of the Patient Health Questionnaire 9 is generally reported between 80 to 90% as well. Specificity indicates the capacity to correctly identify patients without the disorder, implying that 80 to 90 out of 100 individuals without depression will not be falsely identified as having the condition. For example, in a clinical setting, a sensitivity of 0.9 means that 10% of patients with depression may be missed, whereas a specificity of 0.85 indicates that 15% of patients without depression might receive a false positive result. These metrics highlight the balance between identifying true cases and minimizing incorrect diagnoses when using the Patient Health Questionnaire 9 for depression screening. The Patient Health Questionnaire 9 was developed in the late 1990s by Robert L. Spitzer and colleagues as a self-administered tool to assess depressive symptom severity in clinical settings. Initial validation studies demonstrated that the questionnaire exhibited strong internal consistency, with a Cronbach's alpha of 0.86 and robust criterion validity when compared to structured clinical interviews based on the Diagnostic and Statistical Manual of Mental Disorders, 4th edition. Subsequent research by Kroenke and colleagues confirmed the test's sensitivity ranges between 85 and 95%, and specificity ranges between 75 and 85% for identifying major depressive disorder across diverse outpatient populations. Longitudinal studies have demonstrated the questionnaires' utility in monitoring symptom changes over time, reflecting treatment response. Its psychometric properties have been supported across different cultural and language adaptations, indicating broad applicability. Furthermore, meta-analyses encompassing over 50 studies have affirmed the questionnaire as a reliable and valid measure for both screening and severity monitoring of depressive symptoms within primary care and specialized settings. Thank you for watching. For complete information and official PDF resources, visit clinicaltoolslibrary.com or check the link in the description below. And don't forget to like and subscribe for more clinical insights.